Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Sunil Shenvi. He is a multi-organ transplant surgeon. He studied all his undergraduation and post-graduation in India, but he did his fellowship in America. And after that, very surprisingly, he had done LLB and MBA in law as well as the finances. So that is a very peculiar combination of medicine and law. I don't know how it is, but anyway, I'm surprised because I don't have the brain center for either for the law or for the finance. So welcome, Dr. Sunil.
Thank you, ma'am. Thank you for having me.
Yeah. You are a multi-organ transplant. So today we will take the liver.
Yes,
The
ma'am.
liver transplant. Uh, how is it done and which patient it is done? What is the indication for getting the liver transplant?
So, liver transplant is basically done for two liver conditions, ma'am, broadly. One is acute liver failure and one is chronic liver failure. So, what is acute liver failure? Somebody is perfectly fine, liver is fine. One fine day, liver suddenly fails. For example, if somebody has consumed rat poison, suicidal, or somebody has hepatitis A or hepatitis E. Very rarely we see with hepatitis B. So, their liver doesn't have any problem. Suddenly one day they start having liver problem, liver fails. In that case, we have to do liver transplant. That is for acute liver failure. For chronic liver failure, we have already enumerated the causes like alcoholism, hepatitis B, hepatitis C, long-standing fatty liver diseases. So in these patients, the liver is chronically damaged. On a long term, their liver is damaged and they start having symptoms in the form of swelling in the legs. They will have fluid accumulation in their abdomen. They will develop jaundice. So once they start having all these problems, that is when we have to do transplant for these patients.
Yeah, is it only for the rat poison or even any pesticide can cause this liver damage?
So any medicine or any herbal medicine or any pesticide which is causing acute liver failure, they can undergo liver transplantation, ma'am. But in our side, most commonly we see is the rat poison.
Okay. I think some people with the paracetamol also they get, no?
Yeah. In Western countries, ma'am, UK, US, paracetamol poisoning is more common because here generally they don't use ratol poison. So here it is more common with paracetamol poison in Western countries.
Okay. So, but off the label, I mean, they are not allowed to take the paracetamol. How come? Because it is drug distribution is so strict in America. Without prescription, they can't. Not
No,
like in India.
paracetamol is over the counter available, ma'am. It's a OTC drug. Paracetamol is freely available in Western countries. Yeah.
Okay. I didn't know that.
Yes, ma'am. Yes,
Because in our country, everybody can just go in and buy the drug.
yeah.
Now
Actually,
coming to the
paracetamol is recently nowadays few paracetamol tablets have been made OTC in India also. Previously, they were available in pharmacy stores. Even in general stores, now we are getting paracetamol because now they are OTC in India.
Okay, and that is especially when the corona came,
Yes,
they
yes.
wanted the dolo and all that. Now,
Yes,
coming back to the transplant, what are the types of transplant?
transplant, ma'am, we can basically broadly divide into two types of transplants. One is cadaveric liver transplant and one is living donor liver transplant. What is cadaveric transplant? In this, the patient who is brain dead, whose brain is dead but heart is still beating. For example, somebody who had severe accident to their head or somebody has a stroke. So the brain is dead, but the heart is still beating. From there, we will remove. If they consent for organ donation, the family consents for organ donation, we'll take out the full liver and do the transplant. That is called as cadaveric liver transplant. But number of
that liver will be still beating the pulse. I mean, the
yes,
blood will be flowing and it will be pulsatile. Okay.
Yes, ma'am.
Yeah.
And then other type of liver transplant is living donor liver transplant. We have to understand that currently in Karnataka, more than 1,000 patients are waiting for liver transplantation. Number of liver donations may be around 100 to 150. So what will other people do for such kind of patients or patients who have acute liver failure? In them, the liver transplant has to be done immediately. They may not get cadaveric liver during that time.
Immediately.
The other option is living donor liver transplant. Somebody in the family, close family relative, with compatible blood group can donate
Yes.
half of the liver to the
Yeah,
patient.
that is important, because just because they're relative, that cannot be. So compatibility must be there. In this compatibility, you take the tissue compatibility or the blood compatibility.
For liver, ma'am, generally we just take blood compatibility. For example, O blood group can donate to O, A blood group can donate to A and O, B blood group can donate to B and O, and AB is the universal
Universal donor. Okay, okay.
universal
That's great.
recipient, ma'am.
Recipient. Okay,
Universal recipient. O can donate to anybody. O can donate
Yes,
to
yes,
A, B,
yes.
AB, and O.
Now, how much of the liver do you take, and what happens if the donor donates the liver? What happens to that liver? Please tell us.
Yes. So generally, ma'am, for living donor liver transplantation, we see whether the patient is a child or a adult. So for child, we generally take the left part of the liver, and for adult, generally we take the right part of the liver. For adults, we generally take around 40 to 50% of the liver for the recipient. But good thing about liver is if we remove the part of the liver has a regenerative capacity. So it regenerates quickly. For example, if we cut hair, the hair regenerates. If we cut nails, nails regenerate. Similarly, if you
Yes.
cut liver, the liver regenerates.
Okay. How long it takes to regenerate?
Generally, ma'am, 90% of the liver regeneration will occur in 7 to 10 days, and
Wow.
another 10% will regenerate over a few weeks.
Oh, that is really wonderful. It is so magical,
Yes,
because we
ma'am.
know the brain cells or the heart cells or kidney, they don't regenerate.
Yes,
And
ma'am.
even the muscle for that, I think liver is exceptional, and it
Yes, ma'am.
regenerates so fast. And that
Yes,
is
ma'am.
very nice. Now, coming to the any complications for the donor, because you are taking the thing, is it as safe as the kidney, or what is it?
So cadaveric liver transplant, ma'am, the donor is already brain dead, so there is no risk.
No,
But for
yes.
living donor, definitely there is risk. The risk is very, very low. But any medicine, any surgeries, as any small surgery like even C-section, even laparoscopic cholecystectomy also has risk. Similarly, living donor liver transplantation also has risk. It is not completely risk-free, but the chances of having a complication after living donor liver transplant is very less because they undergo a structured evaluation and the surgery is done very meticulously. And
Okay.
after surgery, we take care of them post-operatively very, very carefully. So risk is minimal for living donors.
But even then, anecdotally, we hear and there that the donor died because of the bile leak and the peritonitis and the complications like that. And
Yes,
those
ma'am.
are
So
very, very, yeah.
yeah, in literature, the donor mortality, living donor liver mortality in literature is point 5, 0.05%. Like out of
Oh,
500,
okay, okay.
one donor death may happen. So that's
Okay.
the so it is not
Very
completely safe.
extremely rare, but
Yeah,
it
but
is not safe.
fortunately,
Yeah.
in my hand so far, we did not have any major
Okay.
complications with the donor.
God
But we
bless you.
have to
God
know.
bless you.
Yeah,
No,
thank you.
why I ask this is I'm in the transplant committee, and the two incidences. No, one 70 years father-in-law, for him 32 years old daughter-in-law was giving the liver, and in other case a 37 years old engineer, for him, his mother-in-law who was 52 years was giving. So I was feeling bad for both of them, because 32 years old lady with two children donating her liver, if something happens, for the sake of 70 years old man. And here the amount of mental pressure that will be there on her. And on the other hand, the mother-in-law donating. So, I, with the concern, I told my daughter, oh my God, what is this, you have to give the daughter, you have to give the dowry, you have to give everything to them. And on top of that, give the liver also,
No,
and
ma'am.
then she's
I think no. Basically, ma'am, there are a lot of ethical issues. You just told that
no,
I am
yeah.
LLB because just to tell you why I did LLB because I got interest from transplant laws only. So there is a
Okay,
separate act for transplantation, the Human
okay,
Transplantation Act, and according to law only we do things. So
okay,
generally, age as such is not an absolute contraindication. Somebody may be 70 years, but they their body may be as good as 60 years. So there is no age criteria, like strict age criteria for recipient. If you go to abroad, in like currently I'm in US now, here the age cutoff for recipient is 65 years.
65.
The
Okay.
age cutoff for donors, for living donors, is they should be major. That means they should be more than 18 years. And generally, we don't go above 50 or 55 years. Somebody who is
Okay.
55 and they are very well preserved, don't have any comorbidity.
Mm.
Though the chronological age is 55, but the physiological age is like less than 55, like 40, 45, we accept them for donor. But
Mm.
the donor evaluation is extremely carefully done to make sure that the donor have no risks or minimal risk when we are doing a living donor liver transplantation, and donor is especially elderly.
Okay, okay. So 55 is the cutoff. But nowadays the alcohol has become omnipresent. Almost everybody is taking, including the women. So is there a strict criteria to select the donor?
The
Because
alcoholic
if
donors we don't accept, ma'am. Alcoholic
okay,
donors we don't accept.
okay.
They
But
should not have. They
otherwise,
should not have any history of alcohol. They should not have any poorly controlled diabetes. They should not have multiple medicine needed for hypertension. Or see, these kind of donors will not accept, because in them risk of undergoing surgery is on the higher side. So generally we don't accept.
yeah, and also the liver may not be as good as the
Yeah, liver may not
normal person.
regenerate both in
Regenerate.
recipient and donor. So we will generally say no. Generally, what happens is, when we have, if we get three donors, living donors come to us with willingness to donate, out of them, two will be rejected, only one person will be selected. So the rejection rate is quite high because of multiple issues. As you said, alcohol, they may have
Yeah.
hepatitis B, C, diabetes, and all. So we are very, very careful in selecting the patient for living donation, because we are really worried about their well-being. We don't want to have any complications in donors, especially.
Yeah. That's really important, because for my own husband who had a hepatitis B and we went for the liver transplant, I with great difficulty I got 5 people, and all the 5 were not fit to donate the
Yes,
liver.
ma'am.
So
Yeah.
all were rejected, and ultimately I got the cadaver liver, and by then my husband was not fit to take the receive the
Yes, yes,
thing.
ma'am.
So in our country,
Very unfortunate, yes, ma'am.
yeah, very unfortunate, no, and the things are so difficult, and I
Yes,
think
ma'am.
people should come out for donating in time, and taking care of their healthy life is very important. Now
Yes, ma'am.
after the transplant, what care should the patient take and the donor should take?
For donor, generally, there is not much restriction, ma'am. They are like any other normal person. For recipient, most important thing is they should take lifelong immunosuppressant. Because somebody else's liver is in your body, so your body can reject it. So they have to
Reject
take
it, yeah.
lifelong
Like
immunosuppression. Generally,
it
for
is like a foreign body, and our nature is to reject whatever is from outside other
yes,
than
ma'am.
our own part. So that is
Yes,
the
ma'am. So
yes.
just generally for liver patient, we generally give one or two medicine maximum, generally one medicine. Secondly, whatever has caused chronic liver disease, that has to be controlled. For example, if they are alcoholics, they have to quit alcohol. If they have hepatitis B or C, it has to be treated. They have to change their lifestyle to make sure that they don't get fatty liver. So these are the important things. Other than that, generally for people like me and you, there is some discount about lifestyle. No, generally we
Yes,
should
yes.
not eat fatty food, but some
Yes.
very rarely you can have fatty food. You can drink water
Mm.
from here and there. For transplant patient, they have to follow all these things very strictly. There is no
Yes,
discount. They have
yes,
to
yes.
drink clean water. They have to be very particular about their food. They have to be very particular about their medicine. There is no discount. Other than that,
Yeah.
there is no
Yeah.
special things for these patients.
So like waterborne or the foodborne diseases or the food poisoning, the normal people can tolerate, but not these people,
Yeah,
you
they
are
will not
saying.
tolerate. So yes,
Now,
ma'am.
what is the lifespan after getting the liver transplant? How long do they survive? And what is the cost of this transplant?
Yes, ma'am. So survival, ma'am, the most critical time is first 1 week to 30 days. If they pass those 30 days, then they are unlikely to die. Statistics wise, we say 1 year survival of liver transplant is around 90 to 95%. But if they don't do liver transplant, their 1 year survival will be as low as 0% or 5%. So that is the phenomenal difference from 0 to 5% to 90 to 95%. So that we have
risk,
to understand.
risk and benefit, when you weigh, you know, the benefit is much more than the risk.
Yes, ma'am.
Okay.
For example, I have seen when I was doing my fellowship, I have seen one lady who had come for delivery,
Hmm.
who had undergone liver transplant when she was a baby, 1 year child.
Oh, I
So
see.
such a beautiful results are there.
I know.
One
Yes,
of my
Jayalaka.
teacher himself has undergone liver transplantation, and he
Okay.
recently retired as a head of the department of one of the prestigious institution.
Wow, that is phenomenal. So you have educated our viewers so nicely, so beautifully. Thank you very much, Dr. Sunil, for teaching us and telling us about the liver transplant. Thank you.
Yes, ma'am. Thank you so much, ma'am. Thanks for having me.
Thank you.